Welcome to Start By Listening, the podcast about sexual harm and trauma.
We are centered on educating and empowering our Western Kentucky communities.
Our goal is to transform the way we talk about sexual harm and trauma.
Transformation begins by listening to understand.
We talk so you can listen today and change the world tomorrow.
Welcome, everyone, to Start By Listening. It's Jennifer, your friendly therapist, with my co-pilot, co-host, main partner in crime, Shelby Silsky. How you doing today, Shelby?
Wonderful. Hello, everybody. I'm glad you're joining us for a wonderful episode today.
Oh my gosh, guys, gals, people, dogs, cats, whoever's listening. We have an amazing guest here today with us. I am so honored to bring to our podcast Dr. Jim Tidwell. He is the Vice President for Population Health at Owensboro Health, and he's also a plastic and reconstructive surgeon. And so welcome, Dr. Tidwell. We are so glad to have you today.
Yes, thank you for being here.
Well, thank you, Jennifer and Shelby. I'm happy to be here.
I know when I had emailed you and then we met and I approached you, most people are kind of like, what is this? A podcast in Owensboro? And you guys, he was awesome. I talked a lot about new beginnings and we talked a lot about the health of our community. And Dr. Tidwell, would you just kind of give us an introduction to who you are and your current role at this, one of the largest employers in the western part of Kentucky and probably one of the largest providers of healthcare?
Yeah, so I'm really fortunate to be a part of the Owensboro Health Organization. I came to Owensboro about 7.5 years ago. Was recruited as a plastic and reconstructive surgeon to help. My partner and I started a reconstructive surgery program. We mostly focused on breast reconstruction following treatment for breast cancer. But soon we're involved in wound care and facial trauma, hand trauma, and any kind of reconstructive procedure needed. So it was really, really cool to be able to bring that what would be a new practice for our organization. But about 3.5 years ago, I took on this role as Vice President of Population Health. I had a big kind of life change, and we're going to talk about trauma today, but I had a spinal cord injury that left me with a condition called quadriplegia, where my arms and legs and are impaired. I sit in a wheelchair now and have limited function with my hands and arms. But so I don't operate anymore. I do see patients in clinic. I see my partner's post-op patients, and I help set patients up for surgery for them. But my main role now has become kind of the overseer of our population health efforts in our organization. And that, in short, what I like to tell people is that population health is what we do as a healthcare system outside of the walls of our hospitals and clinics. So all of our efforts to help people be healthy, so that we're not treating them in our clinics and hospitals. I guess if I could do my job perfectly, I'd put our organization out of business, because people would just be healthy.
I feel like that's a very popular nonprofit saying, is we're all here to work ourselves out of the job.
Yeah.
Right.
Yeah.
So population health, that was a perfect segue into trauma. So my first question really has everything to do with your job, is how do you see trauma and health correlate within our community?
Well, I think the most important realization that I've had in this role is that we need to do better as a healthcare organization of helping people who are well stay well, and then identifying those people who have had adverse events in their lives, be it physical or mental illness, and we need to do what we can to help people heal.
I love that. That is beautiful. I'm curious, like my wheels are turning. That's why I pause, because I get all these like thoughts and ideas and questions. When you took on your new position at Owensboro Health, you talked about trauma, you yourself being a survivor of a traumatic experience. What is probably the most surprising thing that you have learned in this role regarding the mental health of the communities that we serve?
Well, that's a loaded question, because as we all know, we had a great deal of mental health illness prior to the COVID-19 pandemic, and I think as any traumatic event might do, the pandemic really was influential in causing a lot of additional mental health issues, mental health needs. And while we recognized the need even prior to that event or pandemic, it just increased exponentially. And that's, I guess, not terribly surprising, but can almost seem overwhelming at times to recognize the need that we have to in our communities. And it's not just it's not just our community here in Owensboro, Kentucky, Davis County, but it's everywhere that we've looked at health needs assessments. Mental health is coming to the top of those assessments as maybe the greatest healthcare need that we have right now. It rivals, common things like substance abuse and most of us Americans, and I'm speaking for myself, carry some extra weight, and that's a pandemic in and of itself. But mental health issues and that healthcare need has even surfaced to the top among those other widely recognized needs.
Absolutely. Yeah. When I first moved back to Owensboro in 2010, I left in 94 when I graduated high school, and I went away from school, went to Louisville, Kentucky, and went to Bellarmine and went to Spalding University. Came back home in 2010, and I did a brief stint in the emergency room as their weekend social worker as I was completing my BSN for nursing. And then I moved from there to the ICU as the nurse case manager. And I remember distinctly being in the ER on the weekends and like the need of like trauma. And back then I didn't understand trauma. I was a social worker in the early 2000s, nobody talked about trauma. It was like, what's trauma? But the people that would come in and have like so many somatic problems, migraines, IBS, constipation, general fatigue. And I would be like, wow, it seems like our emergency room is now being used like as just a primary care doctor, which I know that's one of the things Owensboro Health has really worked on so hard by opening up different clinics to kind of funnel people to, I think, more appropriate, right, ways of getting their healthcare needs met. And I'm curious, because you talked about the pandemic, what has the hospital seen in the last 3 years as far as clients, I call them clients, patients, being able to access the correct avenue of healthcare so that our ER and our hospitals can be not flooded, with like earaches and things of that nature. That's just something I was curious about. If you have any information about that.
Well, you're exactly right. A lot of people and kind of the younger generation of folks included in that do like to have their needs met immediately, and so sometimes that translates into seeking care at an emergency room or perhaps in an urgent care setting, because that's just kind of the way life is for most people now in this highly consumer based world that we live in. Is like if all of a sudden I have an earache, I want to be treated all of a sudden, just like so many other things that we are demanding of in society. And so, yeah, we do recognize that. And in addition to that, there are a number of people who just don't have a primary care doctor and maybe haven't been connected to any kind of healthcare. And there's a significant percentage of people who are seen in the emergency room who have mental health issues, and that contributes perhaps to people not being well established with a primary care doctor. So part of it, what we've done is recognize the barriers to receiving good preventative primary care. And so we've really worked to expand the number of primary care providers that we have, and to put them, spread them throughout, geographically our service area, so that they're more accessible. One thing that the pandemic taught us is that a lot of healthcare can be done pretty effectively, in particular. Treating mental health issues can be done pretty well over through technology, doing telehealth visits, and so that has provided access for a lot of people who maybe they couldn't have come into the clinic. Sorry, I can hear someone sneezing.
Yeah, isn't that great? It's like, that's what it's authentic. It's like
that's pretty organic there.
Yeah.
But yeah, telehealth has been something that came out of the pandemic that we're using much more than we used to. But great question. That remains maybe the biggest challenge for hospitals and across the country. That's a very expensive way to provide preventative care. Primary care is in the emergency room. So getting people connected with a primary care provider is just so important.
So as you were talking, I wanted to bring up like barriers to care, that primary care, which is why a lot of people are clearly seen in the ER. And the one barrier that I heard you mention is accessibility, location. So that goes into transportation.
Yeah.
What other barriers are you seeing, and what interventions are you leading from your position? I mean, as looking at community health as a whole, are you a part of any of those initiatives, and what are they?
Yeah, absolutely. And you mentioned transportation. I'll give you one example here that's close to home. My office is physically located above the Owensboro Health urgent care on Ford Avenue, and that building is connected to our health park and some of our other offices here. And what we saw a week or two ago was that the bus route changed, and the closest bus drop off to the urgent care, to the clinics that are here in this building was actually we had a physical kind of shelter, the little bus stop shelter. It was removed kind of all of a sudden, and we saw a notification that the bus route had changed, and recognizing that it was that is an issue in terms of that creates a new barrier for those who are seeking help at the urgent care, or just on the floor above me is where we have our audiology services and our behavioral health clinic. So anybody who is using the bus system for their transportation to their care, we also have a full lab and radiology services down there. The bus route changed, and so we really reached out, and I have to give credit to Debbie Zerner on the side of our community engagement team, but she really advocated with the city manager and said, "Hey, this is what are you doing?" And they have figured that out. They've reinstated a route that they're gonna. They do their analysis of how much it's used and whatnot, but that's just one close to home and very recent example of how we advocate for people and trying to overcome those things that we know are barriers to access. So that's a long answer, and I haven't quite answered your question, but I did want to affirm that transportation is one of those issues. There may be folks out there who care for children or are caring for their grandchildren while their children work, and those type of things can prevent somebody from being able to go into a clinic. And so, with that in mind, we've explored the option of creating an at-home practice, be it a nurse practitioner or a physician who could make visits to people in their homes, overcoming that barrier. We're not quite there with some of the things that we'd like to do, but we're certainly exploring those options.
As you were talking about transportation, I mean, kudos to you all for noticing it and getting that changed, the bus stops. We have a staff member here that routinely writes to the Owensboro Transit System and lobbies for covered bus stops at every bus stop. So that's one of her ways that she does community advocacy.
We don't lobby, we advocate. We're a nonprofit.
Oh, gosh, I said the wrong word, didn't I?
You did. We don't lobby, we advocate.
That's right. Okay, Boca, don't come after me. Vala, don't come after me. Those are our big federal grants, Dr. Tidwell. Back in 2009, 2010, let's give a little information. As I was completing my nursing degree in the state of Kentucky, you have to do like 120 hours, after you take your boards, et cetera, to get your degree. And I was working at the Macaulay Free Clinic, which is no longer around. And I can't remember if you came after that dissolved and became the primary now, or I don't remember how all that works. But this was very interesting. And I've been a social worker since the early 2000s. And the free clinic was an amazing place. And it was a first come, first serve. We did not have appointments because this was even before Epic came on board. So that's predating. And I remember pulling into the parking lot, getting to work at 7:30 to get ready. And people just from one county, I'm going to say Ohio County, okay? People from Ohio County would leave their home at 4 a.m. to drive to Owensboro to sit and wait in the hallway at the Daniel Patino shelter in order to be able to be seen for free healthcare services. And we also had like a little on-site, pharmacy. So we also provided medications, like a pharmacy would to patients. And there was one gentleman in particular who really just, we all have those patients and clients that leave a lasting impression. And when I say to you, he drove a jalopy, like a jalopy that had no headlights. This man used a flashlight, Dr. Tidwell, hanging his hand out of the window, driving from Ohio County at 4 a.m.
Wow.
Yeah.
Yeah. So, in response to your question, I did arrive before the Macaulay Clinic was moved, and I don't know how long it was there, how or exactly when it moved, but you're right. It was kind of absorbed by what is now the Audubon Area Community Clinic, and it's located over there by the crazy busy Chick-fil-A, Frederick, and that is now the area that where people can go for healthcare, regardless of their ability to pay. And we support that clinic, but it is run by the Audubon Area Community Services, which is a community action agency. I should mention that I've had conversations with our residency director. So Owensboro Health 3 years ago began a residency training program to train family medicine residents, and they train for 3 years after they've completed medical school, and then they can be eligible to be boarded by the American Association of Family Practitioners, and so we were super excited to be able to train family practice physicians, and we now have a cohort so there's 6 each year. So we now have 18 who are in training. The first group will be graduating in June of this coming year, and they are very interested in creating a clinic similar to the Audubon area, or what was the Macaulay Clinic, and maybe even taking that on the road, so to speak, where we have a mobile clinic unit, and they staff that and provide that care, and get people who need health care kind of plugged into the healthcare system.
Awesome. Yeah, but I wanted to share that story because I think it's one of those moments, and anybody that's ever worked in healthcare, we all have those moments when we meet someone that really does change our life. And that man, of how he persevered, right? And the things he did in order to get his health met. I could tell you like 1,000 more stories about my experiences there. And it was just lovely. it was just lovely. I think it's the way general practice family medicine it needs to be, where, it's kind of like the old show Cheers, where everybody knows your name, so like when somebody walks in, it's not just, okay, Joe Smith, it's like, hey, Joe, it's so good to see you. How are you? And you really develop those meaningful relationships, which leads to meaningful education about disease processes, which leads to education about medication management. And as you well know, it's a beautiful thing. It's like what we do here when we do crisis sessions, when we do therapy, we talk about coping skills, and we talk about ways to regulate the nervous system to help your body be able to go through stress. And it's through connection with others. That's, I think, is one of the key pieces for healthcare in the future, if we can get back there, that make a difference.
Absolutely, Jennifer. And I think I think we are on a trajectory to where primary care is becoming is better recognized as for its importance. In my role, coming from a subspecialized surgical specialty, I was. You couldn't have been in healthcare and been more removed from the primary care setting than I was, perhaps. And so these last three and a half years in serving in this role have really taught me or helped me remember that primary care is the real heart of healthcare. And that's, I really believe strongly that everyone should have a primary care physician. And if it's somebody that they only need to see periodically during their, healthy, youthful years, then so be it. But I feel like everyone should be kind of plugged into the healthcare system through a primary care provider.
Oh yeah, I agree. 1,000,000%.
I agree, but I'm going to be fully transparent here. The first time I ever saw a primary care provider from the time I turned like 16 was last year. And I told my husband, I was like, I will see a doctor if you see a therapist. And that was the deal. So I went to the doctor and I was like, aha, primary care. I'm adulting.
Yeah, exactly, Shelby. And I think that is a prevalent attitude. Doctors are probably the worst I didn't see a primary care doctor like you, Shelby, for a lot of years. Now, of course, after I got hurt and I have a few more healthcare needs that are chronic, I do see my providers kind of on a good schedule, but I think during our young and healthy years, like you two are in, it's harder because you just don't make it a priority typically until we're sick, and then we want access right away. And I think there's a role for urgent cares and of course for the emergency room, but it'd be good for all of us to be kind of plugged into the system through a primary care provider, especially as we get older and have greater healthcare needs.
Mm-hmm. Yeah. Nothing says embarrassment or shame, literally, figuratively, metaphorically, like when you move from Louisville to Owensboro, you don't have time to find a primary. You go to work all weekend sick in the ER, and you know that you got a big problem, And now you got to go back. And now the people that you've worked with are going to see you in a vulnerable space. And Dr. Holman walks in and says, well, Jennifer, why don't you have a primary care physician? And it was, I mean, I like Dr. I don't even know if he's still with Owensboro Health or not, but at the time he was. And I really liked him. And I said, yeah, that's on my to-do list, but I am really sick right now and I need something. Tell me what's going on.
Yeah.
Oh my gosh.
So Dr. Tidwell, the differences in what you did in the plastic and reconstructive surgery compared to now, what are the differing traumas? Because reconstructive surgery, I'm assuming that you saw people with burns, bites, like very horrible physical traumas compared to the general traumas that we're facing at a community level. Like, how's the difference in looking at them and treating them, basically?
Yeah, that's a great question. As a to become a plastic surgeon, you train typically for several years as a general surgeon, and then do additional training in plastic surgery. And so, on the general surgery side of my training, I saw all, just the whole spectrum of physical trauma from terrible car wreck, injuries that resulted from car wrecks to blunt trauma to sharp trauma to gun violence, just the whole spectrum you see in your training. And then as I focused my training to plastic and reconstructive surgery, mostly I was seeing wounds that were secondary to blunt trauma, a lot of facial trauma, as well as trauma to the hand, and there is a real, in addition to the physical element that is certainly present with those kinds of traumatic events, there's a real emotional, kind of mental side of things, and it's that part that translates pretty well to what I see now in my role. Patients who are struggling with housing, with keeping the electric, with keeping the lights on, not having their utilities cut off. That creates a level of trauma, as you're well aware, that is similar to what I would consider the emotional or mental part of a physically traumatic event. But that is the kind of trauma that I see now, are these just adverse conditions that people have, whether it's limited access to healthcare or housing or relationships. You name it. There are just so many factors that influence our health, and we certainly are, as an organization, trying to put more focus on those factors. We refer to many of them as social determinants of health, or social drivers of health. Recognizing that a person's relationships at home, that a person's housing and living situation, a person's transportation, their access to education and socioeconomic position, all of those things influence a person's health, and may, in many people, influence their health much more strongly than what we do in our clinics or in the hospital.
Are you actually a social worker? Because you're talking about the ecosystem, sociological model of social work. I'm studying it right now.
Yeah, I'm not a social worker, but absolutely. The work that social workers do and case managers is just invaluable in terms of helping people be healthy.
It sounds like that throughout your entire medical career that you really have had an opportunity to witness so many different levels and types of traumas, and looking at the holistic, right, of the person. If you had a magic wand, and here's my magic wand. This is what this is what I use in therapy. I'll say, okay, and I'll have my client hold it like poof, poof. Like if you had a magic wand, Dr. Tidwell, and you could envision like the best system of healthcare that would truly encompass the holistic view. And money wasn't an object. Barriers, could be removed. And I'm asking the million-dollar question, as they call it in social work. How would you like to see the future of healthcare as a system meet the needs of survivors of trauma? And all of us as human beings are survivors of a trauma of some form. So yeah, that's my creative, magic wand question.
So my magic wand would be made of poplar, and it would have either a unicorn heartstring in it or a phoenix feather. I'm a big Harry Potter
fan. Yep, I was gonna ask.
What I think would be the most effective means of helping people be healthier wouldn't necessarily be a dramatic, huge change in the healthcare system, but it would be helping people make better choices. That's really what a lot of healthcare is about. Is empowering people to make healthy choices. I recently visited with a lifestyle medicine doctor named Dr. Scott Black, who's just one of our superstars in the organization. And he spent an hour talking to me about healthy and nutritious foods and getting enough fiber in my diet and finding a means to exercise, and it was really motivational to meet with him. He probably didn't say anything that I didn't really know already, but it was very, very motivating to meet with him, and that's what I think healthcare needs to do for people is empower them to make good decisions. I think a lot of our healthcare needs arise from from our poor choices. There's always going to be car wrecks and always going to be crazy, tumors that show up, and from genetic problems or whatever. We're always going to have some illness, but so much of the illnesses that we see, be it cardiovascular disease or obesity and diabetes, and are largely due to our choices. So my magic wand would be something that I would use on individuals to help motivate and empower them with regards to owning their own health and taking care of it.
That's beautiful. as you were saying that, Shelby, I don't know if your brain was clicking as well, but I think it probably was, because I looked over and I could see like, that's what we do at New Beginnings.
Yep. Motivation and empowerment, the humanistic approach, two big things.
Mm-hmm. Yep. To make best choices and best decisions for them. And we call that learning how to set boundaries with people. We call that learning how to say no. Learning how to rest. Learning how to find and develop co-regulation with a safe person or nature or an animal, so that our nervous system can learn how to be calm and relaxed and safe. Yeah.
I'd also say building resilience so that you're more likely to reach for those healthy coping skills rather than the easy self-destructive ones.
Yeah, great point. Building resilience. I love that.
Important. How do you think we could develop that kind of a model, Dr. Tidwell, of empowering medical now, patients to make healthy decisions and choices? Because the reason I ask that is because I see a fabulous nurse practitioner. I love my nurse practitioner, and she takes her time. And I know the needs are great, and the availability of providers are it's so small. And some people only get the opportunity to talk with their provider like 15 minutes. So how would this beautiful way, it's very simple and I love it. How can we make that like a reality?
I think giving the patient as many tools as we can, and helping them. I like to use that phrase to own it themselves. As I first started this role, I remember thinking through, like, if I had a huge budget, what would I do to try to accomplish what I want to in my role, and part of what I would love to do is to just educate people and kind of help them understand that healthcare isn't something that's so terribly complicated that they can't own their own health, so to speak. If a patient with diabetes, for example, a patient with diabetes should know what their hemoglobin A1C is. That's a lab test that kind of reflects how well their blood sugars have been controlled over the previous 2 to 3 months. And every person with diabetes should probably know what their hemoglobin A1C is, and empowering a person to understand to understand how diabetes makes their body unable to regulate the sugar in their bloodstream. Either they're insulin resistant with type 2 diabetes, or they don't produce any insulin at all with type 1. And that education, I think it really does allow somebody to grab a hold of the reins on their life, and so I think a lot about trying to help patients understand well enough that they feel like they can be the driver, be in the driver's seat when it comes to their own health. And I really think everybody's entitled to that, and we should work towards really helping educate people. I think that empowers people. I say educate people with regards to their to their health needs and what's available, putting data in their hands, making sure that they're seeing the results of their different tests in a timely way, being transparent in our documentation. Now you're probably aware that a patient is able to see, if you saw me today, within a certain number of days, you would be able to look up, the note that I documented in your medical record, our encounter, and I love that healthcare is becoming more and more transparent like that. It really is putting the control in the hands of the patient.
I love that transparency. It's a very trauma-informed approach rather than let me just take this blood. It's this is what I'm doing with it, and this is why we think this is important.
Yeah.
Very effective. I love it. So Jennifer, I think this is a good segue. I thought it was an amazing answer, Dr. Tidwell. We're coming up to an hour here. How would you feel if we did some super fun rapid fire questions?
Okay, I'll do my best. I'll do my best. Yeah.
Jennifer, what do you think? Do you think this is a good time for it?
I think so.
Or do you have anything else you'd like to add?
Yeah. There you go, Dr. Tidwell. Is there anything you didn't get to say before we bombard your neurons in your brain with some crazy fun questions? Is there anything you didn't get to say that you would like to say?
No, I don't think so. We really covered a lot of ground here in the last few minutes, and I'm trying to prepare myself for these rapid fire questions. I'm kind of a slow talker and slow thinker, but I'll do my best to answer these. You're
going to do beautiful, and we just call it rapid fire. We're not really going to go boom. But they're just fun questions that have nothing to do with our topic, and it's just a way to kind of shake it off.
Wind down after trauma talk.
Yeah.
So Shelby, do you want to ask the first question?
Of
or do you
course.
Want me to? Okay.
Dr. Tidwell, if you could have any superpower, what would it be?
Oh, just walking feels like a superpower, and you're asking a quadriplegic, but yeah, I'd love to have just a really fit, strong body again. That would feel very much like a superpower to me. All of you able-bodied folks out there, yeah, that's how you should feel, is that you have a superpower and a super body.
I love that. Powered by informed practices and healthy decisions to keep our bodies in the best way possible.
Yeah, absolutely.
All right. What is your favorite cereal?
Oh, I love Golden Grams, and I can never find it anymore. But one time I found it was a multi-meal cereal called French Toasters, and it was like French toast type. And I really love that, but I don't get to eat a whole lot of cereal, but I certainly did in my younger days. That was kind of my go-to meal.
Absolutely.
Cereal's a good one. So who is your favorite band or musician?
Oh, wow. That's such a tough one. I love people who write their own music, who write and perform their own music. I think there's something, there's just like an added element of maybe it's emotion, experience, or just humanity that comes out when somebody is singing something that they have written. So I love people like Paul Simon and John Denver. I love John Taylor. There's actually people tease me a bit. My kids tease me. I say that I'm a Swiftie. I like like Taylor Swift. She's a songwriter, singer. So just anything along that vein of a singer songwriter.
I love that. So I got to see Paul Simon live in Philadelphia when I was 16.
Wow.
I was the youngest person in the entire audience, but it was brilliant. So
Yeah, well, that's awesome. I envy that experience. That's great.
What is your favorite gadget?
Oh, favorite gadget. What can compete with a good smartphone and all the wireless accessories, the earbuds and I'll share something with you. In my bedroom, I can't just jump up and turn on the fan or the lights. I'm once I lay down in bed, I'm pretty well stuck there until I have some help getting up and back into my chair. So the ability to turn on the lights by saying, Alexa, turn on the bedroom lights, that's a big deal for me. And to be able to control things that make life more, give me a bit more independence. So all these adaptive gadgets are great for me.
Mm-hmm. I'm getting ready to get my first Alexa. I have yet to get one, but I'm getting ready to.
Well, it can be wonderful at times. It can be a little annoying sometimes if she asks you, do you want me to do this for you? And you're like, no, I would have not.
No, that's not what I asked you.
I'm thinking about accessibility so differently after this conversation. But next question, where is your favorite place that you've been or would dream of traveling to?
During my training, I did some fellowship training in both Belgium and in Taiwan. There were centers that did a lot of microvascular reconstructive surgery, and I took my family. We spent 3 months in each of those hospitals, and Belgium was just incredible. Taiwan was as well, for many different reasons. But being in Western Europe, kind of in the center of Western Europe, there in Belgium, where both, the Western Front of both world wars was there in Belgium, and I learned so much history. And our kids, we were kind of quasi homeschooling our children, at the time, and I feel like it was just a really special place where a lot of history happened, and it was the gateway to all of Western Europe. We were able to travel to the UK, to France, to Germany, to Luxembourg, and so that was a wonderful place. And I'd encourage anybody who has a chance to to travel that area of the world. Was really fun.
I'm sure that's amazing.
Yeah. Europe is someplace I would love to go one day. I've yet to go, but I would love to. Do you have a favorite board game?
A favorite board game? Two that just kind of jump to the top of my mind there's one called Settlers of Catan.
Yes.
That
love Catan. Yes.
Playing that. And there's one called Ticket to Ride that I also enjoy. So
I love Ticket to Ride. When I got married, oh my gosh, I don't even know how long I've been married now. Is it 5 years or 7? I don't keep up with dates. But anyway, my husband He is what you would call a collector. And no joke when I tell you that we had to have library shelving built into a room that used to be what would be considered a formal dining room back in the 80s. We had custom built shelving for all of his board games.
Oh, awesome.
Yes. And we have played Ticket to Ride. We haven't played Settlers yet, but he loves Kickstart, and he likes to go on there and, like you pay some money for a Kickstart campaign, and he does it for board games, and then they just kind of show up on our front porch.
We're going to have a game night. I did not know this. I'm learning stuff.
Oh, yeah. I don't think you've been to my house, Shelby, because I think you started way after, and we had the last staff retreat at my house, and it was in February in 2020. So, yeah.
Mm-hmm.
But, yeah.
Dr. Tidwell, you're invited. We'll play games.
All right.
So my last question for you, if you could be any animal out of all of the millions of species in the world, what animal would you be?
Oh, boy. I think either a hawk or a dolphin, I think, something that would
okay. Very different.
Give you some really different experience than kind of the terrestrial, experience that we have as humans, either being able to fly or being able to swim. It'd be a hard choice between the two.
You could just use your Harry Potter wand and just go between them both. My last question for you today, and I have to look at my notes to make sure I ask it correctly, because I just wrote it down and I just changed it before we did the podcast today. What is your go-to, I'm going to say coffee or beverage, because I don't know if you drink coffee or not, order in Owensboro?
I'm not a coffee drinker, but I'm kind of an old school, I love a vanilla Coke. And I really just love the taste of the cola and a little vanilla flavoring. That to me is just a real luxury that I really have no business drinking a soda like that with so many, empty calories in it. But it does really, I do really enjoy it.
Where do you find one in Owensboro?
At Sonic.
Oh, yeah, they have that. Yeah, okay. Yeah.
So I will sometimes get a vanilla Coke at Sonic, and I'll set it in my in the cup holder in the truck, and it'll last me a week. I'll just kind of sip it and enjoy the taste,
Oh, and you get the 44 ounce, right? You got to get the big one. Is that an unhealthy choice?
I'm not going to admit to it, Shelby.
Oh my gosh. Well, Dr. Tidwell, this has been lovely today. Wow. Thank you so much for saying yes. You.
Well, thank you. Thank you for having me and for being advocates for those with trauma and for all the great work that you do. It was very nice to meet you, Shelby, and to be with you again, Jennifer.
Absolutely. And for all of our listeners out there, we want to say thank you so much for tuning in. And you can change the world tomorrow just by simply start listening today. And have a lovely day. I can't even talk today. Have a lovely day, everyone.
Bye. Thank you.
Bye-bye.
Well, we've made it to the end of our episode. We want to thank you for listening. We hope you'll take something you heard today and use it to change the world tomorrow. We wanted to thank our music producer, Seth Hedges, from Uriah Wild Media. His website is in the show description. Also, a big shout out to Roddy Newton, our technical advisor.
See you next time. This project was supported by grant number VOCA 2020 Green River 26, awarded through the Kentucky Justice and Public Safety Cabinet by the U.S. Department of Justice. The opinions, findings, conclusions, and recommendations expressed in this program are those of the authors and do not necessarily reflect the views of the Kentucky Justice and Public Safety Cabinet or the U.S. Department of Justice. Thank you.